Residents of long-term care facilities are among the first to receive the doses of Pfizer's vaccine, and a local care center is expected to receive some doses next week. Joining us now to talk about the distribution process is the CEO of St. Paul's Senior Services, Cheryl Wilson. Hi, Cheryl. Thanks for joining us.
You're very welcome. Thank you for having me.
So tell me about the plan for the vaccine distribution once you get them.
Well, we had to register very early on with CVS as a pharmacy that would be a distributor, and we did that. And so now the vaccines are in San Diego, and they'll be rolled out to the acute hospitals first, and then they will be coming to the next most vulnerable group, which is our seniors. And not only our seniors, but the staff who serve them. So we will be planning, we are in the planning phases now for those immunizations to be on site and delivered by the CVS pharmacy. They'll be doing the immunization clinics with us in our buildings.
When did you register with CVS, and do you think that was key in getting the vaccine so quickly?
I do. Our staff is very on the ball, and so it was about 2.5, 3 weeks ago that we received an email asking us if we would like to register for the vaccines, and of course we immediately did. And CVS has been in touch with us on several occasions, and they've given us all of the criteria that we will need to set up the clinics so that they can just come in and with the immunization product themselves and deliver the immunization into the patient's arm. But the rest of it is up to us, and we are ready.
So do you think other long-term care facilities that didn't get a hold of CVS or do anything might now be behind the 8 ball and they might not get their vaccines until much later on?
I would certainly hope not. I would certainly hope that the outreach that the pharmacies have done has been very thorough, and that if people were so busy that they didn't respond initially, that they would have had a second or third chance to do that.
Yeah, I would hope so, too. Can you tell me just specifically, I don't know how many older people you have, but somebody's going to have to get it first and second and third and so forth and so on, how you decide specifically which individuals are in line in what place?
Well, primarily, our number one product will go to our skilled nursing facility residents, and we're very proud of the fact that we've had no cases in our skilled nursing facility throughout this pandemic. And then after that, our staff in that skilled nursing facility will get it, and then in our residential retirement communities, assisted living and memory care facilities that we own and run will receive the vaccine. The residents will get it first, and then our staff will get it very soon thereafter. We're hoping on the same day. So
when it goes to, like, just pick one of those facilities, if the vaccine goes to one of those facilities, does everybody at that facility get it, or might some not get it and they'll have to wait?
We are planning for everybody to get it. However, if certain seniors decide not to get it, to opt out, because of fear or some other medical conditions where they cannot and should not get it, then I don't think we'll get 100% in each building, to be honest with you. I think that would be very extraordinary. But we're shooting for at least 60 to 70% of all of our residents. If we get 70%, then we get herd immunity within our buildings, both our staff and our residents, and that will be fabulous.
Is there an issue if somebody doesn't want to take it? I know we're going to be talking with an attorney who's going to be discussing whether employees can opt out of taking the vaccine at a certain line of business, and it seems like there might be a gray area there.
Well, we can't mandate that our staff take it. We are doing a lot of education for our staff, both written, videos, question and answers with our medical director, lots of opportunities for our staff to share their concerns if they have any. We will have staff that for personal medical reasons cannot and should not take the shot. So we will not get 100% of our employees. But I do not believe that we can mandate it either. I think we can encourage and we can educate. And education is the key here.
Cheryl Wilson with St. Paul Senior Services. Thanks so much for the time and all the interesting information. Great to see you. Appreciate it.
Thank you, Logan.